To us. So Dr. Johnny, why can asthma issues be especially problematic this time of year?
Well, there are three reasons. One is a change in weather from the warm, humid climate to the cold air. And it also has the ragweed pollen in it.
Yeah.
The increase in the amount of viral infections, especially flu, COVID, other respiratory viruses, and the exposure to secondhand smoking, vaping, especially for school-age kids who start school in September. They get exposed to the vaping from other kids, and sometimes they do vape as well. That can increase their asthma risk.
Mm-hmm. So allergies and asthma too that are just seasonal, those will aggravate the lungs and aggravate people who have asthma?
Yes, and it is very important for those who already have asthma to take their inhalers. The least refill rate happens during summertime. When they feel okay, they don't refill their inhalers or their inhalers expire. And when it comes September, when their ragweed pollen is high, the viruses are high, which can exacerbate asthma, they are suffering from the symptoms of shortness of breath, cough, wheezing, etc.
And because it is warmer right now, maybe like you said, people aren't refilling, people aren't thinking about it so much, but it's coming. And we know that the seasons will change and it'll be cooler too. And what is it about cold weather that aggravates asthma?
It's mostly the viral infections.
So it's not actually the temperature.
It is temperature also, but it is exacerbated by the presence of the viruses around, the presence of staying indoors during that weather when people go back to school, back to work, more so than the summertime, more exposure to other kids in the indoors during school areas.
Yeah.
So that's the time when they get more infections from the viral pathogens that are out there.
So you were actually saying that now is the time of year that people need to be getting their vaccines for viruses like flu and COVID to help give them some defense, right?
Absolutely. Though the viral vaccines for the flu, the COVID-19, they get starting availability in late August, early September. So that's the time when most patients who have asthma or have had prior problems with breathing, they should take their vaccines early, especially elderly and the young kids.
So what can people do to relieve symptoms, either if they're a patient themselves or they have a family member who has asthma? What can you do?
I think mainly to stay away from the smoking, vaping, trying to wear a mask if they are at a higher risk of getting infections, especially if they are immunosuppressed. Also trying to make sure that they refill their inhalers on time if they already have a diagnosis of asthma. But if they start having new onset symptoms, talk to your doctor.
Yeah. What about if people, during the summer we had a lot of poor air quality alerts. So if people have felt like a little bit aggravated or a little bit struggling to breathe, does that mean they have asthma? Do they need to see a specialist?
If they have a new onset of breathing problem that has not been prior evaluated in the past, it could be a lot of other things as well. So it is important to see a doctor who can finally diagnose whether is there anything else that is going on. Is it just asthma? Because it can be a whole slew of other things, including pneumonias, including inflammations, other diseases of the lung that could also present with shortness of breath or cough. So it's important to see a doctor if you are having new onset symptoms.
What are you seeing the most of right now? What do you think is most commonly coming into the clinic?
Asthma. Asthma exacerbations are at the most, especially with hospitalizations and ER admissions during the second and third week of September. That's when we always recommend our patients to make sure that they use their peak flow meter. If they are an asthmatic, they get a device at home that they can use that can tell them if they are going towards an asthma exacerbation. If you are using your asthma inhalers twice in a month at night time, that wakes you up with breathing problems, your asthma is not well controlled. You should talk to your doctor before it ends up getting worse enough that you are ending up in the hospital.
All right, Dr. Johnny, all good tips. Thank you so much. Dr. Johnny from UTHealth Houston, thank you for joining me this morning.